Thank you, Carol. And thank you very much for staying behind in this Saturday afternoon. I'm sure you have a lot of plans in the evening, so hopefully we'll have an interesting discussion before you start your exciting evening. As Carol mentioned, I worked a little bit on policy, so you can expect this session to be a little bit less action-oriented, but a bit back to the policy angle. And of course, also about climate change, but main difference of this section compared with the earlier one will be we will focus on the health impact of climate change. Can I just have a quick understanding? Anyone from the government or public service that you'll be very familiar with the policy cycle and everything? Anyone from the government? No, okay. Oh, someone there. Okay, great. And anyone from the health sector that we're talking about health today? Thank you. Well, we have a lot of experts here. Just a quick introduction about the area that I'm going to talk about today. A little bit, very little bit on climate change in Hong Kong because our previous speaker, some of you were here. We have already talked about that. And then the second part will be climate change and health. Have we really thought about, okay, with all these changes in climate, how is it going to affect our health, human health I'm going to focus on. And then we will look at the health impacts of climate change, especially for Hong Kong. Whether all these happenings that we talk about at the global level, whether they're actually relevant to Hong Kong. And then on the very last part, I will talk about the policy implications, focusing again on taking into account the health impacts that climate change may have in Hong Kong. Are we having any existing policies in this area? I'm sure some of you have looked at the climate change report, the action plan of the government issued just last year. Anyone notice whether there's any policy that talks about focusing on the health impact of climate change? We'll definitely have a look at the end of the presentation. Very quickly, the official definition of climate change we're all familiar with. Of course, we have to pay attention to the underlying part that climate always change without human being, it always change. But then when nowadays we talk about the changes that is attributable to human activity, in addition to the natural changes that will occur anyway. So a very, very simple question. Is climate change equivalent to global warming? We heard a lot about global warming. Are they the same thing that the polar bear may think they are the same? Anyone here, just quick show of hand, are they the same? If you think they are the same, then put down your hand. Okay. No, they're not the same. Climate change, global warming is one of the climate change phenomena, and it is also a cause of climate change. So what are the climate change phenomena that we are always talking about? Obviously, temperature change, extreme temperature. You can see from this graph here, rising of temperature is happening in most parts of the world. So temperature changes. What else? Sea level rise. The last talk focused on sea level rise. The red bit there is more contemporary. You can see it's uprising. And then the blue part, you can see is the projection. It's not going to get better, but worse. And then what else? Water temperature. Yes, precipitation. And then a very quick illustration that precipitation is getting extreme in terms of annual average, frequency, and intensity is all on the rise. Okay, the fourth one. We have precipitation, we have temperature, we have sea level rise. Last one. What is that? Okay, disasters. We have a lot more climate-related disasters that are happening. You can see the blue bars there. The blue ones are the climate-related disasters. Of course, what we just talked about, storm surges, and flooding, and heat waves. These are all the climate-related disasters. The number is actually much, much higher than some of the more high-profile disasters like earthquake. So you can see climate change is definitely causing more extreme weather events, and which are definitely relevant for Hong Kong. So just 4 blocks that we want to remember today. what is climate change? It's not just about the temperature. It's also about the rainfall, the sea level rise, and more climate-related disasters. So, anyone heard of this? Of course. Paris Agreement is the latest global agreement that talks about, that focus on climate change. A very famous target that countries have agreed to put into the agreement that Hong Kong government, Chinese government are all committed to do is to limit the rise in temperature. And IPCC is like the scientific body that looked at the global evidence on climate change and its impacts. And the latest report was issued in 2014, which is really like the authority that whatever climate change information, scientific information you need, we all refer to the IPCC report. Okay, are these 4 blocks that we talked about, are they all relevant to Hong Kong, or just 1 or 2 of them are relevant? You can see all these photos and records from Hong Kong. So obviously, temperature is a big issue. You can see that 2015, we have 1 record, which is the highest annual mean temperature. And then another record in 2017, which is the annual maximum temperature, record breaking again to 36.6. So obviously, temperature is relevant, but not only temperature really. Look at all these projections done by the Hong Kong Observatory. All these 4 aspects are happening to Hong Kong. Rising temperature, rising sea level, extreme precipitation, and extreme weather events, they're all happening to Hong Kong. So finally, finally to climate and health. So does climate change actually make us sick? Apart from someone saying, oh, okay, I'm sick of hearing about climate change again, like the US president. Well, I hope it's not only that you're being sick of hearing of it, they're actually really causing real impacts on our health. In what ways? Is it infectious disease, or causing injuries, or chronic disease, or mental health issues? Anyone have a guess? How is climate change affecting our health? Anyone of this? Yay. Thank you very much, our friend from the health sector. Through all this, climate change is actually affecting our health. So we may not be aware, but the WHO has actually said that climate change is a defining issue for our health systems in the 21st century. And the Lancet Commission has said climate change is posing a catastrophic risk to human health. And then IPCC, the scientific body that just mentioned, is saying that climate change is going to exacerbate existing health problems and even causing common activities to be compromised. So it's already very well recognized at the global level that climate change is posing very serious impact to our health and our health systems. So how does it happen? How does the higher temperature making us sick? You can see the first block is about the direct effects of climate change, which were the 4 things that I talked about, flood and drought, the extreme weather events, so direct effects. And then from the direct effects, we have the indirect effects, air pollution, drinking quality of drinking water, and then together with all these social dynamics, the very last block, the gray one, you can see all the impacts on health, which include all the 4 blocks that I talked about. It affects our physical health and also our mental fitness. So I'm going to just skim through this because they look a little bit similar. But you can see it's all. The first block is the 4 things that we should always remember, the phenomenon of climate change, and then how the pathways in the pink box, and then how it's going to affect our health in terms of causing infectious disease, not only more, but it may change the pattern because, say, a very simple example is the vector-borne disease. With a higher temperature, you can imagine more active and suitable environment for our mosquitoes. So what's going to happen to dengue fever, which is always a concern in Hong Kong? And then for non-communicable disease, how is the temperature going to affect our, say, heart disease? I'm going to show you a little bit of research that we have done. And then on trauma, conflict, maybe a little bit less, but accidents, it does happen, right? When we have like storm surge. They're all a little bit similar, so I'll spare you with this. So we have already, well, I force you to agree that climate change is relevant for Hong Kong. What about all these health impacts that I have just mentioned? Are they also relevant to Hong Kong? Or not really? I mean, like, we are still healthy and fit. I don't see the government like telling us that, climate change is going to affect your health. Is it really true? Or it's just that we don't talk about it? According to our research, climate change is definitely relevant for Hong Kong, and its impact on our health is real. Some of this, we take reference from overseas researchers, but some of this, we have done local research looking at the climate change on the local health in Hong Kong. So you can see a lot of temperature-related illnesses, non-communicable disease, especially heart and respiratory disease, and communicable diseases, the vector-borne ones, and also the waterborne, and also some physical injuries. And actually, mental health is getting big. For example, like in U.S., after the very major field hurricanes happening in the Florida area, mental health issue was a very big issue, especially in terms of the following up. So how can I say that the health impact is relevant to Hong Kong? Do I just, I think it's relevant? It's not. We really did some research locally, tried to understand the climate change effect on local health. Because we believe that if we don't really understand the magnitude of the problem in Hong Kong, we don't have the basis to advise or give any views on the policies. I mean, like, who are the vulnerable population? I mean, like, what diseases are really affecting us in Hong Kong? That's why our center, CCOC, has done some local research trying to understand the effect. So, one is about the impact of temperature change on hospital admission.
Climate change and the accompanying extreme weather events pose much health risk to people who are living in Hong Kong.
Weather in Hong Kong was quite distorted recently. Health impact of these extreme weather events can be classified into 5 stages, including behavioral change, self-medication or self-care, medical help seeking, hospital admission, and death.
The Chinese University of Hong Kong utilized data from the Hong Kong Observatory, Hospital Authority, Environmental Protection Department, Center for Health Protection, and Census and Statistics Department. We realized that hospital admission in Hong Kong is closely linked to extreme weather. During hot season, when the daily mean temperature exceeds the threshold of 29 degrees Celsius, hospital admissions will be increased by 4.5% for every 1 degree Celsius temperature rise. For every 1 degree Celsius temperature drop, hospital admissions will be increased by 1.4%.
Our research discovered that some diseases were associated with extreme weather events. These include asthma, hand, foot and mouth disease, stroke, acute myocardial infarction and heart failure. Patients must pay extra attention.
Under hot seasons with a temperature ranging from 27 to 30 degrees Celsius, especially on days with high relative humidity and ozone level, asthma admissions increased along with a temperature rise and peaked at 30 degrees Celsius. Change in asthma emissions was also observed in cold seasons. With temperature drop, emissions increased. On cold days with a low relative humidity, significant rise in asthma emissions was observed.
Extreme temperature events have a more profound impact on adult asthma patients.
As for hand, foot, and mouth disease, which is commonly found amongst children, its emissions are affected by temperature changes. At a daily mean temperature range from 8 to 20 degrees Celsius or above 25 degrees Celsius, a rising trend along with increasing temperature was observed for hand, foot, and mouth disease emissions. Especially on days with relative humidity higher than 80%, emissions increased drastically.
Stroke is mainly divided into two types. Hemorrhagic stroke is caused by the bursting of a blood vessel inside the brain, which cuts down the flow of blood. Within the daily mean temperature range of 8.2 degrees Celsius to 31.8 degrees Celsius, with temperature drop, emissions due to hemorrhagic stroke increased.
As the average 5-day mean temperature dropped 1 degree Celsius, hemorrhagic stroke emission rate increased by 2.7%. The elderly was found to be a more vulnerable group.
Another type of stroke is ischemic stroke, which is caused by blood clots formed inside the vessels of the brain.
If the mean temperature of a consecutive 14 days was below 22 degrees Celsius, with a 1 degree Celsius drop, emission rate due to ischemic stroke increased by 1.6%.
For patients with acute myocardial infarction, much attention is warranted when cold seasons are around. If the daily mean temperature of a 14-day period drops below 24 degrees Celsius, with every 1 degree drop, acute myocardial infarction admissions increase by 3.7%. Apart from temperature, the level of air pollutants as well affected patients with acute myocardial infarction. With the level of nitrogen dioxide increasing, more admission due to acute myocardial infection was expected. Power plant, vehicle and marine emissions are the main sources of nitrogen dioxide.
Comparing days with higher and lower temperature, it was observed that heart failure emission rate on days with lower temperature are 2.63 times of that on days with higher temperature. The elderly are found to have a higher risk.
Asthma, hand, foot and mouth disease, stroke, acute myocardial infarction and heart failure are all related to extreme temperature events.
Okay, I'm sure you want to watch more of it, but you have to pay attention to me now. I will tell you where to watch more of the video. Just a very quick summary of the structure of the research that we are trying to do. You can see as a triangle. The video just now talked about hospital admission, but in terms of the health impact of climate change, definitely not only about hospital admission. Up one level, we also have found that even the overall mortality also changes with temperature. Going down a little bit, before we are admitted to hospital, we also have a range of behavioral change that is caused by the change in the weather. We may very simply wear something different, or once we experience certain discomfort, we may drink more water, or at a certain point, we may even go to seek medical health. Our research have covered most of these levels. And this is an example of our findings of the relationship between extreme temperature and mortality. Mortality actually changes in both hot and cold weather. After reaching a certain threshold, which is 28.2, we see that there's a change in mortality. And okay, 28.2, how relevant is it for Hong Kong? We have also looked at the data from Hong Kong Observatory. We see that in the past 4 years, during the summer, all 4 years, the summer temperature is above this threshold, which means the mortality issue is relevant to us in all past 4 years, and I guess we don't expect a drop in the coming years. This is also some of our findings. I'm not going to go into detail because you have already watched the video. This is another research that we have done, which shows that there is even between districts difference in the temperature change. We call it the heat island effect. And this is the hospital admission that the video talked about. Apart from the overall hospital admission that is related to climate change, we have also found that specific diseases, the hospital admissions, is also associated with change in climate, in temperature. So these are the videos that our colleagues are very hard to put together, really to communicate our research out. Research is not only for academics. We hope that our research can be a tool for us to communicate, not only with the policymakers, but also with general public or the health sectors, or even non-health sectors. So anyone, you're very welcome to go to our center and take a look at the very interesting videos. But we would like really to stress that our local research on health impacts of climate change is still very, very limited. And it's not possible for like CCOUC to conduct all the relevant research. So anyone who is interested in research, very, very welcome to consider doing something about climate change impact on our health. So we now all know that the health impacts of climate change in Hong Kong are real and happening. So what have we been doing to manage them? So this very last part was a presentation, a little bit about the policies implication. I know time is running out, so I have to be quick. These are the international policies. Of course, they're not like policy in the national or local sense, but they're very important guiding documents that actually affects national policies. The first one, the Paris Agreement that I talked about. The second one and the third one, some of us may not be aware that they also touch upon climate change. The second one is the SDGs. We know it talks a lot about poverty, but climate change has already been recognized as the main impediments to poverty. Basically, if you don't solve the climate change problem, it's going to affect progress in many countries. And then the third one is about disaster risk reduction, the Sendai framework. The obvious link is the extreme weather events, the disasters caused by climate change. This is also a very big focus in the Sendai framework. Okay, so when we talk about policies that we use to manage the climate change problem, usually we separate them into mitigation and adaptation. Mitigation is something that we hope we can do to at least slow down climate change. And then adaptation is, okay, now climate change is here. How are we going to live? How are we going to live with it? How are we going to reduce its impact for us, especially on our health impact? Very basic examples about mitigation and adaptation. Mitigation, you tax fossil fuels, you encourage the use of renewable energy. For adaptation, actually it's much more relevant for our context, talking about reducing health impact. Adaptation, the last two are some of the examples, some of the policies that we may adopt to reduce the impact of climate change on health. I'm going to talk a little bit more. And of course, you can imagine in this framework, we're not happy just having adaptation measures or just mitigation. You can imagine we always want to be perfect, right? So we also plan for integrated measures, which hopefully will have both effect of mitigation and adaptation. Anyone have read these very important documents, apart from me? These are two very important documents issued by the Hong Kong government that basically really cover everything that Hong Kong government has been doing about climate change. One report on 2015, this colorful one, as it was just issued last year in January 2017. So it's good that you have not read about it, then I can talk about it, right? Actually, health impact has been recognized in both reports, the circle one, so definitely our government is aware of the impact of climate change on health. Then what did the health secretary, our secretary for food and health, what did he say about this issue in Hong Kong? Actually, we see a big improvement. The upper one is from the document in 2015. It was a very, very general statement about climate change, how it's going to affect health. Didn't even mention the context of Hong Kong. But in the latest document issued last year, Dr. Ko actually say that we, of course, is Hong Kong government, right? They are aware of the climate change-related risks to our health, and they have actually set a role for themselves, which is to help Hong Kong people to become more aware of the risks, and for the community as a whole to better prepare. So you can see there's actually very good progress inside the government about what we should do about the health impact of climate change. Okay, after the statements, what's next? Have we actually done anything or set up any policies to achieve this? Just a recap of what. Well, the first one is actually very important. Is a recognition, which is really the first step, and the government has moved ahead to set the role for itself. I think it's a fair statements about to the two good documents. The first document in 2015, we have a very, very strong emphasis on the mitigation. Of course, there was adaptation too, but much, much more about mitigation, which is fair enough. It's about power generation, because power generation actually accounts for 70% of our carbon emission in Hong Kong, and then also about buildings. How can we make buildings more environmental friendly? And then also public transport. How can we have better arrangement for public transport to reduce carbon emission? So the first report has extremely strong emphasis on mitigation, but a lot less on adaptation. But in the second report in 2017, we can see that of course the focus is still on mitigation, but a lot more about adaptation. But among adaptation, health is still a very, very brief reference. A lot of the adaptation measures about infrastructure, which is again fair, right? We make sure like our hardcore infrastructure are ready for climate change. But then definitely health should have a much stronger emphasis under the adaptation section. At least we have the recognition. But then there is no policy that targets specifically at the health impact of climate change. The good thing is we do have some very basic existing structures that we believe the government can actually build on to formulate a specific policy on the health impact of climate change. So our policy call, there are numerous things I think the government have to do, but then we have to be focused, right? We have to prioritize. I think the three basic baby steps that we should focus on is really first to recognize climate change as a public health issue. And then we should also recognize the health co-benefits of existing climate change policies. A lot of the things that the government have been doing or asking the public to do, they actually have benefits on our health. But then in the report or in the government policies, they don't really talk about that much. They have very, very, very brief reference. And then the last one is that we would be calling for mainstreaming climate resilience elements in our health system. I'm going to go through each one of it, but very quickly. Okay, how do we recognize climate change as a public health issue? Yes, the Secretary has made some statements, but then what does it mean in action? FHB have a Food and Health Bureau. I think they really should have like a schedule that they should recognize it. It is one of the part of their work that they have to do. It's not just when Environmental Bureau talk about climate change, then they also make a statement about health impact. It should be like a permanent schedule that FHB has, and they should have, they should support local research to have a better understanding of the issue. Actually, the Development Bureau has done something similar, but of course in their own portfolio. They have set up a climate change working group, and also interdepartmental task force that look at climate change and emergency preparedness. because Hong Kong government has been focusing on the infrastructure, and that's why I guess DEVB has been the first bureau, apart from Environment Bureau, to have a formal structure that look at the impact of climate change on its own portfolio. And then that's the co-benefits that I'll talk about. Okay, after recognizing this as a public health issue, how can we bring this up on the government agenda? We are already doing a lot on the climate change policies, reducing fossil fuel, trying to switch to natural gas, and increasing green space. Why don't we also talk a lot more about the health co-benefits that can be brought about by climate change policies? It is actually a very good way to bring up, to let everyone know that climate change actually has impact on health. When we try to look at the existing climate change policies from the health angle, to see all the health benefits that our current policies can bring about. Well, on the 2015 report, there was no mention at all of the co-benefit concept. And then in 2017, another very big improvement, I think. It talks about health co-benefits, the whole concept, and then health co-benefits was also mentioned, but then again, very, very briefly. So these are the advantages. You can bring up the profile of this whole issue. And then it can also be a stronger justification about the existing mitigation policy. Well, so many benefits to our health, why not? And then the last one, I think the Secretary talked about the whole community preparing for this, which is definitely a good thing. But I believe the government really should start with itself too, apart from educating the public, asking NGOs to join in. These are all good, but then the changes should really start within the government too. And the first thing that we should focus on is the health system. We should build a climate resilient health system. Okay, a very long definition, but basically, our health system should be able to anticipate, respond, cope, recover, and adapt to the changes brought about in our climate. And what we hope for is really not piecemeal changes. Everyone talk about policy, they don't want piecemeal changes, but I understand the reality. But at least we will hope for a system transformation, which is backed by evidence, and that is why we have been doing researches trying to generate evidence so that we can push forward a system change. Not to bore with you with all these, but these are the frameworks that WHO talks about when they talk about health system. And not just the health system. WHO also has a framework that focuses on climate resilient health system. There are already a lot of developments at the global level that we can make reference to. Time is up, but I still have it's okay. I'm just going to summarize. These are the building blocks of the health system. Actually, I only want to highlight one. A lot of them are very simple things, but I just want to highlight this one. On leadership, it is definitely not easy to ask FHB to okay, I'm going to do it, just like DVVB is doing. But we must have FHB recognizing this issue and taking the lead and making it like a permanent agenda. And the power really, the steer should really come from the Steering Committee on Climate Change, which is chaired by the Chief Secretary. If something can be pushed there and ask FHB to seriously consider, that is I think that's the way to go. You really need to mainstream health and make it a permanent agenda under health. And then all this nothing very exciting. But about also the last thing about financing. I'm not sure how many of you are familiar with the budgeting cycle of the government. They look at the baseline and then they will allocate the money. Oh, we did this and that last year, so we will keep doing all this. Of course, it's very important, right? How can we move climate change, the budget for climate change, get a part of the central money to cover this area of work? If not, is it possible if we make it a new money item? Because apart from the baseline, the government also like give out new money if you can come up with some new agenda, new initiative. What we believe is something that is really new, and if FX we try, I'm sure it can make it like into a new money item to ask for budgets from the government. Just a very concluding remark. I talk a lot about health sector, but actually the non-health sectors are also very important in managing the health impact of climate change, because urban planning and a lot of like environmental hazards that will all affect our health. I just don't have the time here. And if we talk about prioritization, I would still think we should focus on the health sector and the health system first. It was just a summary that we all know political will. We need the political will to recognize it. We're not politicians, I'm not a politician, but at least the academic, what we can do, we produce research, we try to communicate our research to the government. Hopefully, we will change our political will. So, sorry about the long presentation. Any questions or discussion?
I'm just wondering, when you talk about the carbon reduction, the carbon emission, on the reduction of that, so what's your view on the government on the taxation of the electric car? Because if you are to drive, then you probably buy a car. So why do the government still have a taxation on that, to impose on that? So is that not kind of discourage people of buying an electric car, kind of be improving it, like the environment? And my second question is on the Paris Agreement about the Donald Trump one. So if the United States are not going to compromise with the Paris Agreement, then so they're not they're probably going against it, isn't it? They're trying to promote on the fossil fuel again, using it again. So is there any backup plan for it? Because United States is kind of big country, and then they kind of, I mean, if they don't join it, then they have a quite big impact in it, isn't it? Right. Thank you.
Thank you for your questions. The first one, well, I must declare I'm not an expert in like taxing vehicles, but I agree that like electric car is definitely one of the great technology that help us to move away from fossil fuels. But I do think that taxing them is still reasonable, because our ultimate goal, I'm sure you will think, is to reduce the number of vehicles. So if we just, okay, all gone, no more tax on the electric cars, then I think it's sort of against our ultimate goal of reducing the number of vehicles and encouraging more use of public transport or even walking. Health co-benefits, right? If you walk or if you drive. So I believe, I think it is reasonable to still tax electric vehicle, but then not at the same extent. And then on the second question about Paris Agreement, so it's actually a question about Donald Trump administration. And I guess his impact is definitely not only on the Paris Agreement, not only on climate change, but on a lot of global issues. Well, I guess two things. International pressure, but then honestly be realistic. Okay, maybe China can do something, but definitely not a very effective way. And then internal pressure. I think the scientists in the US are doing a lot of things trying to raise awareness, and I don't think it's like very effective in the short term, but then we can just do whatever we need to do. And I think the second thing is, okay, even if the US is doing that, I think the even bigger problem is about some smaller countries following the lead, because Donald Trump is even like threatening, okay, you better follow my lead, or where are your subsidies? So I think apart from trying to really affect US, maybe it's more like other big countries like China or the EU, trying to influence other smaller countries not to let them follow the lead of the US. It may be a more effective way, or rather than hoping Donald Trump is going to change his mind. So thank you.